3 or 4 years ago, I started noticing a pain in my lower back and in my left leg that was going really all the way down to my calf. I managed it for a few years because I knew how, when it started hurting, I'd just quit walking. Or if I was standing doing some kind of housework or whatever, I would just stop doing it. So that's how I managed it, and I did that for a couple of years. So it got to the point where I could not even walk through the grocery store without having to stop. The pain was that severe. I went to another hospital and they took x-rays of my entire spine and said that, you know, we really need to fix something in your neck first, which the process that they were going to use was to fuse vertebrae in my neck, and I was going to be in a halo for a couple of months. Well, we didn't like the sound of that. So I went and started doing research on the internet, and I was looking for a neurosurgeon, and I interviewed 2 other doctors, and when I interviewed Dr. Belknap at North Fulton, I just knew immediately that he was the right one.
Ginger Milligan came into our office hurting, but she also came in with such a positive attitude about her care. And she was a little apprehensive about Dr. Belknap. And once she met him and he talked to her, she felt like she was in the best hands.
I think what was amazing about her is she's able to carry herself almost to the point where she looks normal, despite the fact that she was in so much pain, and her MRIs of her spine actually would make me expect her to be unable to even function.
I mentioned to him that the first doctor said that I would need to be in a halo. And you know how sometimes when you get just this tiny little look from somebody that they're kind of like, what? You know, very slightly, because he's so very professional. And he said, well, I wouldn't do that. He said, I'll use cadaver bone and get the spaces right, and then we will fuse 4 of your vertebrae together, and then we'll screw it together. And so it will be stronger than it's probably ever been. That was it. That's all I needed to know. And I felt a complete peace about it.
The first surgery we had to do was help take pressure off of her spinal cord in her neck. She actually had severe degenerative changes in her cervical spine, which was putting pressure on not only the nerves exiting her spine, but also the spinal cord itself. The second surgery we did, once she had recovered from her cervical surgery, was to take away the pain going down her leg from her also severe degenerative changes in her lumbar spine. Over the last 5 years or so, we've been doing a new procedure called IOFlex foraminotomies, which is a less invasive decompression of the nerve roots leaving the spine, in the lumbar spine. In the past, we used to have to do large bony removals requiring fusion, but now we're able to really focus on where the compression of the nerves is and shave away the bone and ligament that's pushing on the nerve. Basically, this is a procedure that's using simple tools such as a rasp to open it up. We take the rasp, and it's almost like a flexible emery board, and we kind of reciprocate back and forth. It shaves away the bad tissue, and we remove it. Most people will leave the hospital the very next day, and we actually encourage patients to be up walking the day of surgery. The other goal is we actually try to have our patients walking up to a mile by the time they follow up about 2 weeks later.
They give you a morphine pump that first night. I never had to use it. I took Tylenol. He gave me a prescription for a narcotic to bring home with me, and I never used it.
They come in for their first post-op appointment, and they're absolutely amazing. And I look at them and I say, you look absolutely wonderful. And the doctors who just did surgery on them within weeks, they're walking, they're not in as much pain, they don't need as much pain medicine. And they're absolutely astonished in that they don't believe that the doctors could have helped them as much as they did.
Before I had the surgery, I had trouble doing just ordinary things. The worst part was that I couldn't lift my 3-year-old grandson. And that's something that I told the doctor. I said, I want to be able to lift Eli again. And years ago, I always said I wanted to be a play-in-the-floor grandmama. And I am. There was a time that I wasn't, but I'm back to being a play-in-the-floor Gigi. I'm at full throttle now. I can do anything I want to. For me, it's been an incredible experience. It really has.